One of the most common and one of the most successful surgeries that we have to treat women who are suffering with urinary leakage, with laughing, coughing, sneezing, is something called a sling surgery where we use mesh. And in today's video, we're going to be discussing all about sling surgery, what are some benefits to getting them, what are potential complications or concerns patients may have, and also why is it controversial? Are you tired of running to the bathroom every few minutes and not being able to make it to the bathroom? Or worse, waking up at night and not being able to get sleep? Well, if so, then you may be suffering with overactive bladder syndrome. And if you want to learn more about it without leaving the comforts of your home, then click the link in my description to get access to the free Overactive Bladder Health Guide. It's a health guide that I created myself to help you get better understanding of what these urinary symptoms are, what are some of the causes, what are some treatment options, and most importantly, what are some simple steps that you can take at home today to help relieve some of these symptoms. Don't wait any longer. Click the link in the description below. I know you're going to find value out of it, and it will give you a better understanding of what these symptoms are. And now back to the episode. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. If you're new and you like what you see, don't forget to subscribe and share it with a friend. Stress urinary incontinence is one of the most common forms of urinary leakage that women can suffer from. Believe it or not, 1 in 2 women will have urinary leakage of some form in their lives. It's more common than you know, and one of the reasons we don't hear about it is because women don't talk about it. It's embarrassing to talk about urinary leakage, and unfortunately, a lot of people, even in today's day and age, think that it's a normal part of aging. Yes, age is a risk factor for developing symptoms of urinary leakage, but never is it normal to leak urine, no matter what decade of life you're in. It's one of the most common things I treat in my office. I treat women in their 30s and 40s who may notice leakage of urine right after they got pregnant or have had their first child. I see women in their 40s and 50s as they're approaching perimenopause and menopause, as well as women much later in their life, in their 70s and 80s, who've probably had leakage of urine for many decades, but never quite got around to seeking treatment. There are lots of different reasons of why urinary incontinence can happen, but the most obvious thing being weakness of the pelvic floor support structure and damage to the support of the bladder, the urethra, as well as nerve damage to the pelvic area. The good news about treating urinary incontinence is that there are lots of amazing non-surgical treatment options, as well as some amazing surgical treatment options. Now, I have many videos that I've done previously where I talk about the non-surgical treatment options. In today's video, we're going to be discussing about a very specific kind of surgical treatment that I do to help women suffering with these conditions, and that is a sling surgery. So what does a sling surgery involve? So a sling surgery is where we put a tiny piece of mesh under the urethra to help support the urethra. So if you can imagine, if this is my bladder, the fist is the bladder, and then my index finger is the urethra. So the urethra is the pipe through which urine comes out. So what we do with the sling surgery is we make an incision vaginally, about a centimeter and a half, and then we pass the mesh around the urethra, and it supports the urethra like a little hammock. Okay? The reason stress urinary incontinence happens is because of the weakness of the support structures for the bladder, for the urethra. So with this mesh, we're essentially trying to recreate that support structure that the urethra has lost. And there could be many reasons of why there is weakness of the support structures, most commonly being age, menopause, trauma to the pelvic floor, which could have started from childbirth, pregnancy itself, women who have chronic constipation, chronic cough, women who are on the heavier side or obese, women who have history of smoking, anything that puts a lot of pressure on the muscles of the pelvic floor, as well as causes damage to those muscles and nerves, can contribute somewhat to urinary leakage. This is one of the most common kinds of sling that I use for my patients, and as you can see, this right here is essentially the length and width of my pinky finger. Now, the mesh itself is made up of polypropylene. Your body doesn't have a reaction to it. Your body doesn't reject this. This does not become cancer. There's been an extensive amount of research that's been done to vet the safety and the efficacy of the mesh. Now, one of the things that always comes up when I talk to my patients about mesh surgery or sling surgery is the whole controversy that's associated with placement of mesh in the body. So yes, early in 2000, there were a lot of controversies about mesh, primarily Unfortunately, women who had a lot of these mesh surgeries were complaining that they had pain with intercourse afterwards. They had pelvic pain in general. There was a lot of scarring of these meshes. Some of the meshes were coming out through the vaginal tissue, and women were getting a lot of infections. The meshes were moving into different organs, which could be the bladder, the urethra. The truth is, yes, some of those concerns are valid, but understand a lot has changed in the last 2 decades. Number one, the quality of the mesh is very different than some of the meshes we used to use before. It's a much lighter mesh that we have now. It's much less dense. It's lightweight. The material is different from some of the older generations of mesh that we used to use. Number two, surgeons like myself, I'm a board certified urogynecologist and a pelvic reconstructive surgeon. And what that means is I have gone through 3 years of additional training to be able to perform these surgeries safely and efficiently for my patients. That was not the case in early 2000. Urogynecology was not a specialty. Believe it or not, we became a board specialty only in 2013. So early in 2000s, anybody who said that they could perform these surgeries were able to do it. And unfortunately, some surgeons with the right background, with the right experience had great results, others not so much. So now, because we're a whole other subspecialty, things are a lot more standardized and not anybody can perform these surgeries. All these changes have made these sling surgeries a lot more safe, a lot more standardized, and the complications that we used to hear about in the early 2000s just does not happen as commonly. Now, when we talk about sling surgeries, there are different ways the slings can be placed in the body, all done through the vagina, but there are some slings that's called retropubic, which means that the sling material goes around the urethra and then it comes out behind the pubic bone. So patients will have an incision inside the vagina as well as 2 incisions right by their pubic bone. There's another sling surgery that we use that's called an obturator sling, where again, the sling goes through the vagina, but it comes out through the groin, so patients will have 2 additional incisions in their groin. The sling that I'm using recently for my patients is known as a single-incision sling. I used to use some of these traditional slings as well, the retropubic sling as well as the transobturator slings, but over the last few months, I have switched to the single-incision sling, and the reason for that is, as you can see, that the amount of mesh material in a single-incision sling is significantly less than some of the traditional slings that we were using before. And looking at some of the data that we have now, the efficacy is pretty much the same. If I can achieve the same amount of benefit for my patients and still put less amounts of mesh in the patient's body, I think that's a win-win. Because again, with the lesser amount of mesh material in the body, there's lesser chances of complications related to mesh. So what are some complications that can happen from these procedures? Anytime we do surgery, there's some basic complications we talk about. Infection is a possibility, so I give patients antibiotics prior to having these surgeries. Bleeding can happen, again, very minimal with these kind of surgeries, especially the single incision sling that I use, because I'm not going into areas where there are any large major blood vessels that I'm worried about injuring. A little bit of bleeding is expected, but nothing that's concerning. Injury to surrounding structures, your bladder, your urethra are close by. I'll be honest, I've been doing this for almost 10 years, and any major complication happening, especially with this mini sling, is very rare. With the mesh, I still counsel patients that you can have something called a mesh exposure. And what that means is a little thread from the mesh can come out through the vagina. And that too is very rare. I do tell my patients who are smokers or who have poorly controlled diabetes or maybe using chronic steroids, they are at a higher risk for mesh-related complications. Their diseases or the history of smoking can affect the tissue quality, but there are ways to counter that, specifically starting patients on some vaginal estrogen to help build up the tissue so that we can avoid some of the mesh-related complications. Is mesh surgery for everyone? Not at all. What I do tell patients is that urinary incontinence is a quality of life issue. And what that means is it's not life-threatening, but it can affect your quality of life significantly. So if you're somebody who's suffering with urinary leakage and it's affecting your quality of life, it's affecting your daily day-to-day activities, you not being able to enjoy all the things that you normally would have liked to do, then don't suffer any longer. Find a urogynecologist or a female urologist who have experience doing these surgeries and talk to them. And maybe after discussing all your options, you decide you want to go the conservative route. That's absolutely okay. But don't suffer in silence unnecessarily because you were scared about the mesh surgery, or you've heard from a friend that they've had complications, or you've heard about all the lawsuits and you're worried that these procedures will cause you significant harm and you don't even want to consider it. talk to a specialist who has the adequate background, who has the adequate training, can talk to you about the data, and let's get you the help that you need. If you found this video helpful and you haven't subscribed already, don't forget to subscribe, and I'll be back next week with more helpful tips and another exciting video talking about your pelvic health. Talk to you soon. Bye.